neurological disorders and pelvic floor. Choose the false statement concerning cerebral palsy. The answer is, children with cerebral palsy experience progressively increasing damage to the brain as they grow older. What medical intervention is most effective in reducing the brain damage from a stroke caused by a blood clot? The answer is, administering intravenous tissue plasminogen activator. Pelvic floor dysfunction occurs in The answer is, both men and women. Diffuse traumatic, many areas of the brain injuries are caused by The answer is, closed counter-coup type injury. Incontinence can be treated with The answer is, all the above. Ed was admitted to the hospital with acute progressive ascending muscular weakness of the limbs, which produced a bilateral symmetric flaccid paralysis. These signs were preceded by a respiratory infection 3 weeks ago. A spinal tap reveals high levels of neuron proteins in the cerebral spinal fluid. The diagnosis is likely a condition caused by the destruction of myelin in the peripheral nerves known as The answer is, Guillain-Barré syndrome. Erb's palsy, an upper brachial plexus birth injury that causes neuromuscular damage, presents as The answer is, paralysis of upper extremity muscles resulting in shoulder adduction and internal rotation giving the appearance of a waiter's tip position. Multiple sclerosis is a disease that attacks the myelin coating of nerve fibers in the The answer is, central nervous system. Tenodesis allows a person with a C5 spinal cord injury to do all the following except The answer is, propel a wheelchair. The pelvic floor consists of what muscles? The answer is, levator ani and coccygeus. Alzheimer's disease is thought to be due to The answer is, abnormal buildup of amyloid proteins which form plaques and tangles within the brain cells. What does a score of 3 on the Glasgow-Coman scale indicate for a person? The answer is, severe head injury. What medical intervention is most effective in reducing the brain damage from a hemorrhagic stroke? The answer is, reduce hypertension and reduce the brain bleeding. Hydrocephalus, paralysis, usually of the legs, bowel and bladder incontinence, scoliosis, hip dislocation and club foot usually presents in The answer is spina bifida myelomeningocele. Find a warning sign that is not indicative of transient ischemic attack or cerebral vascular attack. The answer is sudden difficulty breathing or chest pain. Which of the following most accurately describes myelomeningocele? The answer is a defect in the development of the neural arch of a vertebra where the meninges and the spinal cord both protrude through the opening in the vertebra. Down syndrome is recognized by The answer is flattened facial characteristics and hypotonia, low muscle tone. Of the following, which is not a symptom of multiple sclerosis? The answer is blindness in both eyes. What is the hallmark of spinal shock immediately after a spinal cord injury? The answer is no motor or sensory activity below the spinal level of the lesion. A brain attack or stroke that is caused by an arterial occlusion due to a thrombus or embolism is known as The answer is an ischemic cardiovascular accident. All the following are precautions and considerations when treating a patient with a traumatic brain injury in the ICU except The answer is wear brightly colored clothing to help stimulate the patient. The best statement describing Down syndrome is The answer is a chromosome abnormality resulting from a trisomy of chromosome 21. In men, signs and symptoms of pelvic floor dysfunction may include The answer is all the above. All the following are urge suppression techniques that the PTA may use in educating the patient who is diagnosed with urge incontinence except The answer is sing happy birthday 2 times while running quickly to the bathroom. Which of the following distinguishes Lewy body dementia from other dementias? The answer is misremembering how things happened, has visual hallucinations and falls often. The PTA is rendering active assisted range of motion to the upper extremities of a patient who is 8-week status post-spinal cord injury at T5. The patient complains of a pounding headache and sweat is dripping off their face. The PTA takes vital signs. Heart rate is 105. Blood pressure is 200/110. The patient is probably experiencing The answer is autonomic dysreflexia. Cheryl presents the following signs and symptoms: absence of arm swing during gait, cogwheel rigidity, bradykinesia and tremors at rest. She also has difficulty beginning movement, such as walking, and equal difficulty stopping and turning. She often bumps into walls as a result. Her therapist suspects the answer is Parkinson's disease. The person who cannot apply rules of social behavior violates physical proximity, social rules essentially inappropriate, and becomes angry or irritable quickly and out of proportion. For the situation is most descriptive of a person with the answer is severe traumatic brain injury. The neurological signs and symptoms of a transient ischemic attack lasts. The answer is less than 24 hours. In women, all the following are signs or symptoms of pelvic floor dysfunction except the answer is diarrhea. The Rancho's Los Amigos assessment tool was developed to describe levels of the answer is cognitive function, ability to problem solve, concentrate and behave appropriately, in people with brain injuries. What happens to muscle tissue in the person with Duchenne's or Becker's muscular dystrophy? The answer is, it atrophies. Which of the following neurological diseases or conditions has slow progressive muscle weakness, atrophy and paralysis of limbs, trunk and face, fatigue, but no sensory deficits? Progression may take several years, and death is due to respiratory failure. The answer is amyotrophic lateral sclerosis. What should the PTA do when the patient with a T5 spinal cord injury complains of a pounding headache, the skin is flushed, and profuse sweat is dripping from their face? Their vital signs are a heart rate of 105 and blood pressure of 200/110. The answer is, find and remove the cause of the headache, sweating, tachycardia and high BP, and sit the person upright immediately. The pelvic floor, often described as a hammock, is a funnel-shaped structure. How do the muscle fibers run or attach to bone? The answer is, from the pubis symphysis to the coccyx and from one ischial tuberosity to the other ischial tuberosity. At approximately what age does someone with Duchenne's muscular dystrophy become wheelchair-bound? The answer is 7 to 12 years. Gower's sign is defined as the answer is coming to standing from the floor by using one's hands to climb up the legs. Which of the following is not a risk factor for women of developing pelvic floor dysfunction? The answer is diabetes mellitus. When working with patients with Alzheimer's disease, it is helpful to do all the following except The answer is, encourage the person to accept your perception of reality. The major presentation of someone with advanced Alzheimer's disease is The answer is, no memories and severe cognitive decline. Which of the following is a risk factor for men for developing pelvic floor dysfunction? The answer is, prostate surgery. Someone with vascular dementia shows signs of The answer is, emotional lability, laughing or crying in response to social interactions, and apathy.